Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
And I'm Dr. Adam Bellingham from the Grapevine Dentist.
All right, Dr. B, so we just talked about our real thoughts about snap-on dentures, over dentures.
Yeah.
Okay. Now, what we were just talking about in the previous video, we want to give the patients what our real honest opinions, our thoughts are about the All-on-4, right?
Okay.
Now, there's many different names for All-on-4. I think All-on-4, some people have called it Teeth in a Day, Teeth Express, so many different types of names for it, right? You see on commercials all the time.
Yes.
What are your thoughts, having practiced for 15 years?
They're pretty great. There are very few downsides to doing an all-on-4. I mean, really, the biggest hurdle is cost. Aside from that, from a function standpoint and aesthetic standpoint, if you are needing to replace all your teeth in the best bang for your buck way, and what is driving you is you really want really good aesthetics and you want the best chewing function you can get, all-on-4 is the way to go. I mean, hands down, I have very little bad things to say about them.
So a quick question for you from your perspective, because you're the guy that restores like the actual prosthesis, right? So one thing that people need to understand is the prosthesis is a prosthetic, or prosthesis is basically an artificial limb or body part, right? So this would be the fake gums and teeth, right? And for an all-on-4, there's all-on-4, it's screwed in place. This is the prosthesis. So you're the guy that does that, right? So like, what are your thoughts in regards to like the prosthesis, how it functions for them? Like, what are your like thoughts?
So if we're comparing it to say like a snap-on something denture along those lines. Snap-ons are great. They have really nice retention, as in they stay in real nice. But when it comes to chewing with them, we kind of touched on this in the other video. They're supported mainly by the gums and bone under the tissue underneath there. The implant holds it from popping out, but it doesn't bear the brunt of chewing. It's just, those implants are just there so it doesn't pop out. Whereas an all-on-4, since that prosthesis is screwed to those implants anchored in bone, it's supported by jawbone. And so it functions just like teeth. They're rock solid. And so from a function standpoint, it's a whole different animal. It's about as real as teeth can get. And what's nice is the material we make them out of is different. So snap-on denture is made out of your standard denture acrylic with acrylic teeth.
Plastic.
And so, plastic basically. And so there are some
stain and wear.
They can stain, they can wear. There's some inherent flex in them. They just, if you take it out and accidentally drop it, it's going to crack and break. Where an all-on-4 is solid zirconia. It's made from a block of extremely strong porcelain that is milled out by the computer. It's very, very rigid and very strong. And because zirconia is extremely dense, there's very little chance of it picking up stain, and they're very, very clean. I mean, they did some of our modern glazed zirconias, they did some electron microscope scans of the underside of an all-on-4.
Where bacteria may
where bacteria wants to build up on a patient, worn it for a year. They took it off, scanned it. They're so smooth that there was almost no bacterial growth on them.
That's awesome.
It's awesome. I mean, they are fantastic, option for somebody.
It might sound like we're just like hardcore nerds about this type of stuff,
but we kind of are.
The reason why we want it to be bacteria free is because implants are an amazing option, but in some people excessive bacterial growth can be an issue, and you start inflaming the gums.
It can,
and then that gum inflammation can progress in some people to periimplantitis.
Which is periodontitis, which you may look up around an implant, and that is aggressive. It will eat away that bone around that implant quickly. As you've seen, unfortunately, from a lot of patients that haven't, done their end on maintaining stuff.
As an aside, there was a patient that had an all-on-4 10, 15 years ago down in Houston. Her surgeon passed away. She came up and she said she was having some pain. We did a quick scan on her, found out she had massive infection on 2 of her implants out of 5 she had on her lower. And I could show you guys the 3D scan, but it was so infected. It was actually a miracle her jaw had not fractured. She had lost so much bone, and just all this pus was coming out. This was like severely infected. But why did that happen? That's very uncommon. It's the only time I've ever seen in my career. But she hadn't taken off the prosthesis and cleaned it for over 10 years.
Oh, wow.
Yeah. So that's kind of like, that could be another video if I want to show you like a horror stories about like, you know,
but that's another thing to talk about for the difference between maintenance wise.
Right.
You know, with your snap-ons, you have to take that out every night and clean it. You still don't sleep in them, just like a denture. And those little snap-ons, there's a nylon insert inside the denture, and they are a wear item. Snapping them on and off, eventually they wear out. And you pop them out and put new ones in. And so, maintenance-wise, you take them out and clean them, you replace those parts. With an all-on-4, you brush them just like teeth, and you need to floss underneath them, because there is, and water pick, there's a little bit of space. They don't sit tight overlapping the gums like a denture does. They rest right on top. So you clean under there to get anything out. You floss and water pick because you got to keep those implants clean. Right. But you only take them out. Typically, you come to us and we take them out once a year to clean around your implants, make sure everything looks good, and clean your prosthesis, and then on it goes again. Right. So maintenance, while it is probably less with an all-on-4, it's equally as critical because we've got some bigger stakes in there. You don't want to lose an implant and have issues like that. But maintenance is really pretty easy on an all-on-4 from a patient standpoint.
One other thing to add on for like an all-on-4 that a lot of patients, there's a lot of confusion. I think there's a lot of bait and switching on marketing online.
Yes, that's right. Yeah.
You'll see all the ads for Google when you look for all-on-4, and then someone has all these ads and they'll do it for an insanely cheap price, and they're like, wait a second, this is way cheaper than I was quoted somewhere else. A lot of the bait and switching happens with the actual prosthesis.
Yeah, the materials it's made of.
Yeah, whereas we were talking about, we use Zirconia, a much higher end, better product that we just discount it to make it more accessible to people. The other option is, I've seen with those the discounts, they'll just give the temporary acrylic as the final solution.
Yeah, so history of all-on-4s, the original final prosthesis for an all-on-4 was a hybrid of a metal base and then denture acrylic and teeth on top of that.
Right.
And that used to be the final.
Right.
And that was before we had the technology to do computer milled zirconia.
Right.
Well, that's old technology.
Yeah.
And but there are those places like you were talking about that will bill that as their final prosthesis of like, oh, it's all acrylic and off you go.
Right.
And the problem is they're much more fragile.
So let's tell them, what are some of the downsides about that?
Oh, downsides of full-on acrylic ones are really fragility. While acrylic is fairly strong, you can now that it's permanently affixed to implants, the amount of force you can generate on that prosthesis is high. The human jaw can do over 600 psi on a tooth. We got some people can chew, and acrylic that's made for a denture that can only be chewed against gums is not designed to take that kind of force. We do them as temporaries because you can modify them really easily, and we can really tweak them for healing purposes.
If you want the teeth in the day, you have to use the acrylic.
Yeah, you have to use acrylic.
Yeah, and it doesn't have the titanium bar underneath.
Yeah, we don't do that anymore. Right. That turned out to not be a good thing.
Yeah.
They turned out to be weaker. But from that acrylic is fragile. If you bust a tooth off of it, well, then you got to unscrew the whole thing, send it off to the lab. It's going to be gone. You're going to have no teeth for a couple weeks. And they put it back together, and we just found that the acrylic is not designed to hold up to those kind of forces. It just doesn't. And so you tend to break a tooth off, you'll break an edge, you'll crack the whole thing. And so that's where zirconia comes in. This stuff, zirconia, the thickness of what these things are, those suckers are strong.
Yeah, I hate it.
you are as short of doing something nuts like opening beer bottles or chomping on rocks, man. You're not gonna break these things.
Zirconia, like the zirconia bridges, zirconia crowns, we use them a lot in dentistry. Man, if you gotta cut off a bridge, like a zirconia bridge.
Man.
Yeah, it's a chore. You got to have these types of like diamond burrs.
Yeah,
like,
when I have to cut off a zirconia, when I see that I'm replacing a zirconia crown on someone that's got cavity under it, my first thought is, Oh gosh,
Yeah.
I'm gonna need a stack of burrs.
Yeah.
I mean, I'm gonna go through 15 burrs to
Yeah.
cut these things off.
Exactly.
And those are only 2 millimeters thick.
Yeah.
These things are like 6, 7, 8 millimeters of solid zirconia.
Yeah.
They're robust.
If you had to cut it off, it'd be a damn nightmare.
Oh yeah.
Yeah. So that's
I'm gonna
something.
need a chainsaw.
Yeah. That, realistically, that's like the biggest bait and switch that we see with all on board with pricing. They try to draw you in. But this just a cheap plastic one, and you probably want something higher end, or what? Actually, there's another. One of our employees actually used to work at a discount implant all-on-4 center, and she said that one of the bait and switches that doctor would do was he would advertise on Google a really cheap price, and then the patient would come in, be excited. Oh my God, I got an all-on-4. I found a really cheap price. Get it done. Later on, a tooth breaks off, and they're like, wait a second, I spent, $14,000. How did this tooth break off? This is ridiculous. And then they say, well, you got the PMMA plastic model, right? And, well, what are you talking about? And it's like, yeah, maybe, well, this is because it's plastic, PMMA, it broke off, but we have a higher end option that this won't happen to, and that's another $5,000.
Yeah.
So that's where the bait and switch happens. They already were committed, and so they don't want this consistently breaking off. Because it can happen, right? You go on vacation, tooth breaks off, you call your dentist Monday morning at 7:45, and you're like, hey, my tooth broke off. So actually, that's the reason why we don't even offer the acrylic options, the hybrid.
And it's a
PMMA.
huge hassle. I mean, anything that has to be repaired with acrylic has to go to the lab.
Yeah.
And so it's just time without teeth. And
Yeah.
and the way that, just talk about bait and switch up, the way that a lot of places market their all-on-4s, teeth in a day, it's not quite true.
Yeah.
There's a lot of, you don't just roll in off the street and bam, we do surgery and put some teeth in you.
Yeah.
There's a lot of preparatory work that goes into that.
Would you go with a home builder that says they can build you a brand new home from start to finish in 1 month?
Yeah, just there's how or
Yeah, and trust me, we're trying to move as fast as we can, but we still want to do things right so that you're not going to have long-term complications.
Exactly.
Right.
Exactly.
So to me, that's the biggest thing for me. Like, I don't like hassle. I don't like long-term hassle. So
predictability is what we like.
Exactly. I want everything to move as fast as possible, within the confines of be doing a good job and predictability.
Yeah.
And it's kind of funny that you talk about that, but yeah, also the teeth breaking off, and the other thing too is like PMMA being plastic. I mean, keep in mind, you're talking about the jaw forces and stuff like that, but they say that they recommend every 5-7 years that you replace your teeth and your gums on the titanium bar, the hybrid prosthesis.
Oh yeah, the acrylic ones, they do recommend it because you will wear those teeth out.
They wear and
you'll
they
flatten
stain.
them down. If you've ever had grandparents that had an old set of dentures and you look at them, the teeth will be flat.
Yep.
They're just acrylic. They'll chew down, and then you've got to make a new one. Well, zirconia, the minimal wear. I mean, we're talking in 20 years, you'll barely have blunted the cusp tips on these things.
Yeah.
I mean,
So that's
solid.
another thing.
Longevity also is, these will practically, barring anything unusual, last indefinitely.
Right.
I mean, to be honest, they will.
So all-on-4s, depending on where you go, I mean, for us, all-on-4s is about $5,000-$6,000 more than a snap-on denture. But again, that's hard to say because how many implants are you getting on your snap-on denture versus your all-on-4? What's the anatomy? Yeah. That's why we have patients come in for consults, because some cases are easier than others. We can give you a more competitive offer. Some cases are just incredibly difficult. Some patients have infections all in the wrong areas, have a lot of bone loss. Some people would need extra bones, some people would need extra implants. There's so many different factors that come into the cost of an
your
all-on-4.
bone density, you may need more implants if you got softer bone versus somebody else who's got concrete bone, things like that.
So that's pretty much is there anything else that you wanted to add in regards to what your thoughts are for
Not really. I mean, like I said, from a restorative standpoint, and from a patient happiness standpoint, I've never had anyone regret doing an all-on-4.
Right.
I've never personally, this in my practice, ever met a patient that got an all-on-4 and said, oh, I wish I hadn't have done this. Most of them are like, I should have done this 10 years ago.
Yeah.
After wearing conventional dentures, or those are the patients that really love them. The ones that went from conventional denture to an all-on-4, they're just like, oh my God, why didn't I do this 20 years ago?
Right.
They really are the one of the most revolutionary things that's happened in dentistry when it comes to replacing full arches of teeth. I mean, it's a huge game changer.
I tell people, due to cost, time, because patients are dental phobic too, they don't love going to the dentist all the time. I know this might sound extreme, but I tell people that All on 4 did to dentistry what freaking Uber did to the taxi industry.
Yeah.
It just completely revolutionized it.
I mean, the way we used to have to replace full arches was, oh my gosh, it was multiple implants and custom milled bars to hook them all together and trying to do acrylic over that and just 5 million billion steps, and things never really fit because there was, everything's milled out, lost wax castings, just all kinds of just craziness. And All on 4 brought in a predictability that we never had before, to where you can just make your prosthesis and they just fit. Like, you get it back from the lab and it just goes on the implants and we screw it in. It's just a whole another level of, when I first started out and we were being taught prosthetics of how to do this, everybody's like, why would I ever want to restore a full mouth and implants?
Right.
And now it's just so much better. It just is.
Yeah.
But,
so, I mean, yeah, hopefully you guys found this information helpful. Like, that's our thought on, like, All on 4. We really love it.
they do. They're great. They really are.
It just makes so much financial sense sometimes.
Yeah.
Like for us, I mean, even, like, we're telling patients that they can save money by doing it All on 4.
Yeah.
Right?
We totally understand that it's expensive. Yeah. It's not cheap.
Yeah.
But there are times where trying to restore what you've got left, and if you're one who unfortunately maybe has some health concerns that make it difficult for you to maintain your teeth, or you were head and neck radiation or lots of medications and dry mouth, etc., and it's a losing battle of every time you come in, there's something that's got to be fixed on your teeth over and over and over. Well, at some point, it's not worth the money of trying to keep saving everything, and it's best to just pay that big money up front and get something that's going to last you for the rest of your life. It's now a tool in our arsenal that we used to not have, and it's a really good tool.
Yep. Okay. Well, I totally agree.
Cool.
Hopefully you guys found this information helpful. If you could, give us a follow and a thumbs up. Any other comments?
Nope, that's about everything we got.
Awesome. Thanks, and we look forward to seeing you guys later.
Thanks a lot, guys.